Thank you for the introduction, and I was asked to speak in English. And it's been a while since I've presented anything in English, but I'll try my best. Okay. So I'm a professor of biomedical engineering department of Korea University, and I'm a CEO of Korea Medical Devices Development Fund. So we are actually investing 1.2 trillion Korean wons actually to boost up the Korean medical devices industry. And from the perspective of technology, I'm not an expert of these issues like IVD devices and kits, but from a strategic point of view, I can probably provide something useful to you. Okay. So my talk is composed of three categories. I'm going to briefly introduce my institute, the Korean Medical Devices Development Fund, KMDF. And I'm going to talk about some of the IVD-related researches which is being supported by us. There are about 15, and I'm going to be talking about probably some of them. And finally, I'm going to be talking about commercialization strategy that KMDF is building up right now. So here's the overview. So here's our vision. We want to build a nationwide platform for sustainable medical devices research. So we are building a full cycle support system all the way from technology development to market entry. And our objective is to enhance, expand our market share, both in the domestic markets and industrial in the international markets. So as I just mentioned, we have about 1.2 trillion Korean wons. Over 6 years, we are supporting so far, in 2020 only, we have selected 337 projects. And there are all kinds of projects, not only just IVD, but there are all kinds of conventional or futuristic devices we are investing. KMDF is being funded by 4 different government agencies, government ministries, Ministry of Science and ICT, and Ministry of Trades, and I can't see it very well, Industry and Energy. Ministry of Health and Welfare, and Ministry of Food and Drug Safety. There are 5 different categories in large and that we are supporting right now. So basically, our strategy is, and before it was there was insufficient and duplicate supports for R&D, research and development in medical devices field. And they have been supported by different ministries. We are trying to build a consistent support centered on KMDF. And there has been some criticism that says that there was segmented and partial support, and especially on the later stage of the commercialization, there were not enough support from the government. We are trying to fill that gap. Okay, and there has been criticism also about the regulation issues. We are actually collaborating with the regulatory agencies of the government, and we are building up some ways to ease down the difficulties or go around specific problems. As I have just mentioned, there are 4 government ministries which are supporting us, and here's our KMDF organization. We have board of directors and operating committee, and also government funding agencies like NSF or KATE or KAIDI is actually working with us, trying to gather our elaborative efforts. We have 3 teams: management team and R&D support team, and commercialization strategy team. Okay, so I have brought up projects, 5 different project categories which has been supported by us. There are actually 2 more, but they are individual projects. So there are 5 large categories. First is categories for global competitiveness. So in that category, there are a lot of projects which builds the medical devices which already have some competitiveness in the market. And we are trying to make premium devices, premium products. And also, there are lots of medical devices which causes a lot of trade deficit. Okay, we import a lot, but not much of export. But there are industries. The industry is not strong enough, and we are trying to boost up their capabilities to international levels. The second category is for market-leading technologies. So we are building devices, futuristic devices, which is targeted to meet the fourth industry revolutions. That category includes some robots and some AI or machine learning related stuff, and also some futuristic materials, biomedical devices materials. Third category is for solving social healthcare issues. We are building medical devices for elderly people and also disabled, and also socially some other patients, which is locally very far from the medical agencies. The fifth one is the infectious disease. I'm sorry. We're trying to strengthen the national defense systems against the infectious diseases such as COVID-19. Okay, so there are a lot of IVD related projects in the first category and the fifth category. Okay, this is the structure of our projects, and I have broken it down to 9 different TRLs, technology readiness levels. So very early stage of the research is technology, TRL 1. If you mass production is in TRL 9. So our projects mostly starts at TRL 4 or 6, and they end up at 8, which means we are targeting to actual commercialization of these products. Also, there are projects which is building some basic technologies which can be converted to future medical devices. The major principle of our structure is that we are following the National R&D Innovation Act, which is started to be active this year, and we actually reinforced the evaluation systems, and we are trying to maximize the performance, which is actually a commercialization. So, well, technically, I'm not an expert in IVD devices, as I said, but I'm going to try to explain, what kind of new technologies are being constructed, being supported by us, which is related to COVID-19. So you probably are very familiar with this chart in here. This is the status of IVD global market. And the 2020 global market is estimated to be $83 billion US dollars. And it is expected it's going to be growing up to like 4.5 annually, which is going to be reaching up to $113 billion in 2027. Okay, mostly, the global market is, mostly focused on immunoassay issues, 32%, and hematology molecules. I can't see very well, and others. Okay. So here's the domestic market status of IVD. As I said, this is a statistics that has been built in 2019. So they do not include what happened until last year. Last year was a year there was a huge change, as you all know. There was a pandemic situation, which actually made there was a major game changer. And domestically, it is estimated that the annual growth rate is going to be up to 2.9%. And in Korea, and from 2019, and our strength was in molecular diagnosis, and second was immunochemistry. So basically, they have matched the needs of last year's, and that probably is why we were pretty strong last year, and which built the name of K-방역, I think. And here's a list of major players Bioneers and Seagen, and many other companies and academic institutes. Of course, the last year was kind of historic year from the medical devices industry because there was a transition from trade deficit of about $450 million to surplus of $510 million last year, mostly because of this of your effort of COVID-19 situations and pandemic situation actually built this kind of changes. And there was in the first medical devices company in Korea which sales extending 1 trillion Korean won, and that was the first also. We have support of many IVD related devices in our research, and among them there are about 15 COVID-19 related researches. And among them, there are 8 devices research, and IVD kit 5, and materials 2. And some of them are focused on molecular diagnostics, and some are immunological diagnostics and POCT. And the figures that I'm going to be showing right now has not been brought from the actual proposal of their proposal because of the intellectual property issues. So, I mean, we just, collected, the right figures, probably matches well with their intention from already published data. So the first thing that I want to show is that there was a all-in-one isothermal PCR using a LAMP. LAMP is a loop-mediated isothermal amplification PCR, which is new technology. So what they're trying to build is an all-in-one PCR. So here's a conventional diagnostic method. There was a harvest and nucleic acid extractions, amplification, and detection. And they're trying to put all these 3 stages together into one stage. So this is one of the researches we are supporting right now. And also digital photonic PCR, which is quite new, I think. So this uses a plasmonic phenomena. So for nanowells, there are nanoparticles, nanostructures in there, and the PCR material is going to be illuminated by light. There's going to be rapid heating and cooling procedures, which does a pretty rapid PCR. So this is also being built. And there's also automated immune diagnosis platforms. And the top picture is just a regular immune diagnostic platform in there. They're trying to build a system which can read all these results rapidly, and they use full automation and barcode identification and liquid level detection and high throughput diagnosis. And also, there are several groups. I mean, I know that there are already a company which have built this kind of systems. So they are trying to build a system which can do the diagnosis on not only just the COVID-19, but the influenza also. So not only just the influenza, and there are a couple of more viruses that can be detected using this system. Okay, the next one is a development of NGS. NGS stands for Next Generation Sequencing Based Molecular Diagnosis. What this device does is that by using some kind of informatic analysis and AI technologies, they are trying to detect the mutants. And there are several materials research for IVD, like a high affinity nitrocellulose membranes, and nanowells and channels, and new swab and wipes for sample collections. Okay, and the final issue is that, so what the KMDF is doing to facilitate the commercialization process. So here are some of our strategies. I can't explain the details of these. I'm just going to give you a brief ideas. Bulk ideas, what kind of efforts we are doing right now. Okay, as you all know, from the R&D stage to all the way to commercialization, there are lots of stakeholders. Okay, there are lots of agencies and stakeholders that have to be involved to finally put something into market. Okay, there are the licensing, regulatory agencies, and medical devices clusters like Osong and Daegu, and government agencies we are collaborating with, and medical institutions, and enterprises. And we are trying to various kinds of advisory systems like clinical, technology, investment, market, and IP and support. So I have listed the kind of programs that we have established to help out this industry from low TRLs to commercializations. From the clinical point of view, we are actually collaborating with a lot of medical institutions, trying to put their inputs into actual products. And the patents, we are actually imposing the system that the patent issue has to be checked first for each individual project, because there are lots of projects that end up failing because of these patent issues. So, and also we are working with Osong and Daegu and trying to help to build the prototypes. The regulatory agencies, we actually built in MOUs, each one of these agencies, and we are working closely together, trying to improve our communications with the industry. And our KMDF has a lot of experts which can help targeting the markets or defining the markets, not only just domestic market, but international markets also. So, I have been talking about KMDF's effort. There are also a lot of programs that has been proposed and actually executed by KAIDI. Okay, there's an ID support programs by KAIDI, and the first thing is that the rapid acquisition of export licenses. There are about 23 products that actually received the export licensing by collaboration with KAIDI. And also, for a lot of samples in the emergency time, they actually introduced a lot of medical institutions to collect, the right samples for preclinical data. And also, not only just us, they are also investing some funds to raise the new technologies. I think it is really, really important that the government, as I said, there are a lot of stakeholders in terms of commercialization of medical devices, not only just IVDs. And we are actually trying to build a lot of communication routes. Let me just have tell you that June 16th, which is next week, we're going to have comprehensive R&D conference in L Tower. And also we have a lot of, not only just the movies and YouTubes, or we use a lot of media actually to advertise, what kind of efforts we are putting to help them out. And we are, talking with, VCs and companies. And if there are some issues, regulatory issues, we are meeting with them and trying to collect their data, their ideas, and bring it to the right government agencies. Okay, that's what I have prepared for today. Thank you for listening.